Hello, and welcome to the Mindful Mike. I am Colbi Twiss, one of your co-hosts here.
And I'm Grace Shimatsu, and we're so excited about today's episode. We're going to be talking all things kids and concussions, a very relevant topic. And for this chat, we're joined by one of Children's Home's very own psychologist, Leah Gallant. Welcome, Leah.
Thank you so much for having me, Grace. Great to be with both of you.
Yeah, well, thanks so much for coming on. We're really excited for the conversation today. I'd love to just start before we dive into the topic by you giving our listeners a little bit of inside information about yourself, who you are, and your role at the Children's Home.
Sure. My name is Leah Gallant. I'm the PhD psychologist postdoc resident here at Children's Home. My role really is to assist the team in providing diagnostic information with patients and clients across the lifespan and work with health support systems and collaborate closely with clinics and schools in the Treasure Valley.
Leah, I'm so excited to have you here. We had a discussion, Grace and I, we were talking to you just kind of casually about the vast knowledge that you have. And one thing that came up was concussions in kids and how it relates to not just sports, but to everything, right? Whether you're jumping on a trampoline or where you're on a scooter. And you started talking to us about it. And I was thinking, this is such a great thing for parents to know. And there's so much to talk about and to dive into here. I even reached out to a bunch of my mom friends and I said, is this a topic that everybody would be interested in? And I had so many reach out to me and say, yes, I want to know this, 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 and this. So we have a bunch of questions to ask. But let's first get into what your definition, I guess, of, concussions is. Like where, we talked about it's not just related to soccer or sports or all that. Like I said, it's a whole bunch of things that can happen to kids. So let's just kind of start with, I guess, the top down.
Yes. So a concussion is when there is impact to the head and the brain moves suddenly. And that sounds ambiguous because there can be a lot of different ways that the brain moves suddenly. It can be anywhere from a mild movement to something that's really severe. And traumatic brain injuries do include concussions, and they can be on a spectrum from mild to moderate to severe. It's so important to keep in mind about children is that their brains and their minds are still growing, and children respond differently, particularly adolescents, to that sudden jolt of the brain differently than how an adult might. That means that there is a longer recovery time that's associated with that. And the recovery symptoms can look different with children and adolescents.
So how do you know, let's say, like, how do you know your kid might hit their head? Just something, it could be whether it's a sport or maybe it's like just jumping on a trampoline and hits them too hard. They might not even complain about it. Is it something you might notice about them that you could say, hey, there's something a little bit, different or something that's off?
My recommendation really to parents, because they are the people who know the children the best. Parents and caregivers really know the nuances of how children operate and how children respond to different types of situations. If a parent or caregiver is worried that a child has experienced a concussion, my best recommendation is to take the child to see some type of medical professional. That can be anything from the urgent care to the emergency room or making an appointment with the primary care provider or the pediatrician. If at home, something that we tell parents is really anything out of the ordinary that comes up is something probably worth investigating. And this can be things from problems with nausea, balance, sleep, mood dysregulation, difficulties with concentration. And those are symptoms that require not necessarily a diagnosis of a concussion, but something to be further evaluated and monitored as a child is recovering.
Makes sense. And if a parent sees any of those signs in their child, they notice that something's a little off, what do you recommend they do next?
My recommendation is getting the severity clarified by a healthcare provider. And that really gives parents and caregivers a way to monitor that recovery over time, and to understand what are increasing symptoms look like? What does reducing symptoms look like? And what can parents do at home to help facilitate that?
That makes a lot of sense. Something, Leah, you and I had talked about before this episode a little bit, the fact that I have a very strong personal connection with this topic as someone who suffered multiple concussions in high school playing sports. And I remember one of the things that was really pressed into me by my parents is the fact that, our brains are the things that tell us when something's wrong, right? And so if we get an injury to our leg or our arm, our brain is telling us this hurts. I'm in pain, something's wrong. And so sometimes after, one of those concussions, I remember telling like my dad, I'm fine. I feel fine. And him saying with concussions, your brain, the thing that's supposed to tell you when something is wrong or right, isn't able to do that properly. And so I can't really take your word at that right now and have to investigate this further, which I think is just something that's always stuck with me. And I felt was important to bring up here that, because I think we see that a lot, if it's injury in sports practice or a game to the head and you want them to keep playing. They're important to the team and they tell you they're fine. You want to let them keep going, but maybe that's not always the best thing, right?
Right. And you're so accurate in saying that. What we see a lot with kids and adolescents who get concussions is that these injuries happen usually while they're doing something that they enjoy. And that can be anything from riding their bikes, being on a trampoline, skiing, playing a sport with their friends. And with a concussion, and we see this all the way up through athletics and college and club sports, is that when we are diagnosing someone with a concussion, we're usually saying you need to take a step back from that activity that you really enjoy and sit out and recover. And that's really hard to do. And that's even more difficult for kids to do, which is why I think we often have this psychosomatic response to a concussion of, no, I'm fine. I'm ready to go back and do what I was doing before. But they do require careful monitoring by a healthcare provider to ensure that they are okay. We also have to understand that when someone does have a concussion, the brain is not necessarily, that hardware infrastructure is not working as it normally does. And the cues that would say you're okay might not be there as they were before the concussion. So it's really important to have a team who know the children well to analyze that and assist in helping that recovery.
Yeah, I'm so glad that you mentioned that they might think they're fine or say, I'm okay. And really, as a parent, you're kind of like, well, are you? And I actually had a mom reach out to me, with the question of, she's played soccer as a child, as a teenager, and now as an adult, she's a coach, and said, how do we make sure that the kids are fine? They might, make sure that they are sitting out, make sure they are getting help and not just telling us what we want to hear. And so I love that, you said we kind of have to be the strong one, right? And say, you have to know, you have to sit out, you have to get checked, right? And so then from there, let's say they get diagnosed with a concussion. They didn't want to be out in the first place, right? What now? Like what's the process? How long do they need to sit out? Or does it take for it to, I don't know if the words get better or heal from a concussion?
What we see, what studies show us is 70 to 80% of people who have a concussion recover within 3 weeks, fully recover within 3 weeks. But that 3-week episode of where symptoms might be significant, it's really important that we monitor those. Those symptoms can be mild, but they can affect things like emotional regulation, the ability to learn new information at school. They might be affecting sleep. During that time when children are recovering, we have to make the settings around them as optimal as possible for that recovery to happen. Screens are something that's not great for concussion recovery. They are a ubiquitous part of our society right now and how kids go to school and how they learn. So reducing that as a child is going through that recovery, being in communication with the school is really important so that those symptoms can be monitored potentially at the school and accommodations can be implemented. And also bringing in, as I mentioned, a healthcare provider to provide that clinical expertise. When we're looking at that recovery optimization, one thing that's happened as we've understood concussions more is that the focus has been on return to play, which is great for kids because they want to get back to playing. They want to get back to being outside. Clinicians have found that there is equally as important emphasis that we need to have on are kids ready to learn? Are they ready to go back to school? And this is very important for adolescents as they're doing higher order thinking, more complex analyses in their classwork. And we found that that is a more nuanced brain recovery than necessarily returning to play. So being cognizant that the brain is a very complex entity and organ in the body, and we need to be monitoring multiple symptoms simultaneously to ensure that they can recover as best as possible.
Yeah, I think that makes sense because we're in a
Yeah,
different
that
time
makes a
now.
lot of sense.
I think we had a crossover. We both just said that
Oh,
made sense.
sorry. Go
No,
ahead, Colby. I think
no,
you froze a little, so I
I
I
froze.
missed what you said. You go for it.
Oh, no, sorry. I was just saying it makes sense because going back to school, we're in a different time now where we're on computers, we're on, it's all in the classroom, right? Either whether it's looking at a book or being
Right.
on your computer all day. So it's not, kids are surrounded, whether you could get home and say, no, no, no iPad, no TV. They go to the classroom and that's really a lot of the part of their learning is on the screen. So Grace, sorry, go ahead.
No, no, you're fine. I was just, gonna echo that. School has a lot of complex things and makes your brain work in really interesting ways. So, I can imagine that return to learning would look different than return to play, something, I haven't thought about.
Yes.
You mentioned that some of these changes that a parent might notice if their kid has suffered a concussion is changes in mood or their behavior. Is this something you see a lot as a psychologist? Like maybe a client coming to you, their parents concerned about their changes in mood or behavior that maybe looks like a mental health issue that could actually be associated with a concussion?
We see adolescents in particular coming in saying that they've had a concussion. And it's often not the first concussion that they've had, saying that they just feel like their mood is different. They feel like they might not be as engaged with a group of friends as they were before. It might be harder for them to be around a group of friends, like hanging out in the lunchroom with a group. They can get overstimulated very easily with different social events. Having that same bandwidth to exchange with friends or exchange in some type of academic or social setting does sometimes feel impaired. What we want to do is make sure that it doesn't rise to the threshold of becoming a diagnosis or becoming a mental illness. So, what we want to do is work in partnership with children and their healthcare providers to ensure that that recovery happens so that we can reduce symptoms so that children feel like they can go back to the activities that they were doing pre-injury. Students, we know this from COVID, when they are isolated and taken away from their friend groups and their peer groups and activities that they enjoy, that's not a normal part of childhood and adolescent development. And while there might be a short window where we have to pull them out of that, we do that because we want them to return fully to what they were doing before.
Mhm.
But that requires a coordination with a team outside of the children to make that happen. And like I mentioned, they usually don't really like all of that happening, but we have to do that so that those symptoms don't rise to the threshold of becoming a mental illness.
So that's a great point. I was talking about, we always think about going to the ER, going to their pediatrician or going to the doctor, but no one's really talked before about, actually going to a mental health expert as well and going that route. So I'm really, really glad you talked about that as being, a resource and something to get involved right away.
Yes. And when baseline concussion testing is happening at the collegiate level, sometimes at the high school level, and at the professional sports level, a person who's on that team is often a neuropsychologist, which is what my training is in.
Mhm.
And what we are doing with neuropsychology, we are looking at how different symptoms and quantifying those symptoms are associated with different behavior changes. So we will be looking at a athlete, how their brain operates at baseline, and then we're looking at that delta, that difference post injury. An athlete has been injured. We're also monitoring symptoms of anxiety, depression, self-esteem, so that we are making sure that we're addressing everything that goes along with
Mhm.
that injury. And in the most ideal situation, what we are hoping to do is work with a team of physicians so that that recovery can happen and we can reduce symptoms that might be associated with some type of anxiety or depression.
How does it work if a child doesn't have baseline concussion testing? So maybe they're not an athlete and they didn't get their concussion playing a sport. How do we know their baseline?
That is a great question. And the truth is that we don't know their baseline. We can't go back and look at their medical chart and say, oh, this is your baseline pre-injury testing. But we really rely on that parent and caregiver intuition to say, this feels like something is different. And taking a child to a healthcare clinic, even urgent care or the emergency room, they often have someone who specializes in orthopedic medicine, sports medicine there, who can run a concussion analysis and give a series of tests with that child. Things like balance and recalling numbers and assessing if a child is nauseous. And that's a very good way to do that, because children, more often than not, if they are getting a concussion, it's not because of a sports event. It's because of just being kids and playing outside. And bumps in the head and accidents happen. But getting those evaluated if parents suspect that there is any change is really important.
Grace, go ahead.
I was just going to ask you, bring up that, most of the time concussions are caused from kids being kids. What are the most common activities aside from sports that you see that happening in?
Anything that involves wheels. So we see it with bikes, scooters, hoverboards, skateboards, anything with wheels. We see it with kids just playing outside and jumping on things and slipping and falling, or climbing things. Most concussions for kids 12 and under have nothing to do with an organized sport, just normal kid activity. Fortunately, though, kids do recover pretty well from a concussion. And in many respects, the way children's bodies have been evolving over thousands of years, bumps on the head or something that happens, and they do respond pretty well to rest and an opportunity to recover.
Yeah, I think this brings up the importance, although you can't always wear a helmet, stress to parents, right? On a bike, on a scooter, especially I see these kids now zipping down on their scooters with no helmet, or on bikes with no helmets, even if they feel like they're just maybe going down the block or something. And I always think, oh my gosh, put a helmet on. I mean, you're not going to, maybe wear one on the trampoline, but where you can,
Right.
How important
exactly.
it is to put the helmet on.
Yes, absolutely.
So if a concussion happens and the child is resting, maybe they don't rest long enough, or maybe they didn't go to a healthcare professional, it wasn't diagnosed, and they return to play, or they return to their normal activities that they normally interact in. What are the consequences, or what could the long-term effects be of not adequately allowing your brain the time to heal from something like that?
That's a great question. Concussions are cumulative over time. And if a child has a concussion and it's not diagnosed and they are playing normally like they were before pre-concussion, don't go through a formal recovery protocol, the big issue is that if another concussion happens, we want to make sure that we are definitely addressing that follow-on concussion. That's where we can get into problems, especially with brain development with adolescents and young adults, is that the brain is growing so rapidly during adolescence. The only other time over the course of the human lifespan where the brain changes that much is during the third trimester of pregnancy. So we really want to make sure that brain is going through as much as the recovery as possible. If a child did have a concussion, it wasn't diagnosed, and going back to normal activities, we want to make sure that we are looking at things like emotional regulation. Is the child having a difficult time concentrating at school? Are they having difficulties with reading, math, higher order thinking? Are they really exhausted at the end of the day? What does their energy level look like? Are they becoming overstimulated really easily? So noticing any type of change to the ebb and flow of how that child interacted with the world previously is really important to take note of that and monitor that.
Yeah, talking about second concussions. I mean, Grace, you just said, that you're an example of somebody that can get, that second concussion. What does that exactly, do? Even if you got treatment for the first one, you're on to that second one. What is that going to do to that child?
Well, we don't definitively know what it will do to the child, but it can increase the risk for potential long-term difficulties with
Hmm.
emotional regulation, concentration, learning, things like that. We do see patients who come into clinic who have said that they didn't really feel a change in how they went about their lives after the first concussion, but after the second concussion, they felt differently. But most patients who do have a second concussion do recover fully. That period where they are recovering, it's so important to make sure that we're optimizing that recovery as fully as possible so that the brain can rest and the brain can heal, because that's really important to the long-term brain health
Hmm.
for children and adolescents.
Is that something that you would recommend that they are continuously for many years always getting checked on? Or is there a period where you're like, okay, your brain is rest, you're good now? Or is that something that you need to really continually work on and look at
Uh,
for years to come?
yes. I if children have experienced a second follow-on concussion, I think one of the best things parents can do is get baseline concussion testing ongoing, because with concussions, we want to be examining that delta of how they are pre-injury, post-injury, and understanding how that delta connects to tasks related in school, their ability to socialize with friends, and how they are regulating in terms of their emotions. The second concussion does not mean that there is a guarantee of a ongoing chronic traumatic brain injury, but it means we need to be measuring what that difference looks like pre
Hmm.
and post injury, and how do we help that child recover as comprehensively as possible.
You mentioned the importance of a full recovery and fully taking advantage of all that rest time, especially if there's multiple concussions. I'm wondering what advice you give to parents and maybe even clients who are really struggling with finding that balance. For instance, I remember when I was kind of in the stage where I was still restricted in a lot of areas, but I was starting to get, a little bit more leeway. So I could hang out with my friends for maybe an hour at a time and then I would have to come home, or I could look at my phone for 10 minutes and get it taken away. Um, and that was really difficult for the reasons you mentioned, the social isolation and feeling just different than I did before, but also different than the people who were important to me and I was surrounded with. So, how do you help, I guess, both the client and the parent navigate that? I mean, I'm sure it's hard for the parent to say no to things that their child wants to
Hmm.
do, especially when they're struggling.
Yes, it is a complex balance and can sometimes be very difficult to strike and maintain. Years ago, the thinking with concussions was that if someone had a concussion, you put them in a dark room and you kept them in there until they were fully recovered. And then once recovered, they could reemerge back into the world and re-enter their life. And that thinking is not fully correct anymore. What we have found is that reducing stimuli is really important for the brain. But we've also found that touch points that help the brain re-engage with normal everyday activities is important. So socializing with friends is so valuable for brain recovery. We see across the lifespan, one of the best things that people can do for their brain is socializing and maintaining those relationships. The other thing is that we have found that exercise is really good for the brain. Not high intensity exercise or returning fully to athletic practice like someone was pre injury, but exercise is really helpful to the brain. Getting outside, getting fresh air, getting sunlight, all so important for
Hmm.
brain health. Where we really want to be providing ongoing support with children and especially adolescents is in regard to their academics and working with the school to make sure that they have the right accommodations in place to make sure that they are learning the most salient and important parts of a school and classes curriculum, and that they have a reduced workload so that they don't come home and have hours of homework, but they're able to make progress through their courses. Striking that balance and working in concert with the school is incredibly valuable. And most schools now have someone on campus who understands what this recovery looks like and how to monitor those ongoing symptoms. The other thing that's really important is to keep the child's primary care provider in the loop to reevaluate and assess how severe those are, and having that team really working together and keeping the child engaged with how they're feeling so that they're providing feedback ongoing as well.
Yeah, I think that's really great that you mentioned about keeping the school involved and getting resources there at the school, right? So maybe a test looks different for them now, or they might need more time, or things that help they didn't need before, and just communicating to the school. And I think it's important that parents, because I actually didn't know that and to think about bringing the school involved until you said that parents talk to all their teachers, talk to the principal, get those aids and requirements, to help them with things that might take them a little bit longer. So I'm glad that
Right.
you mentioned that.
And yes, and so much of school's online and on screens right now. And screens are not great for brain recovery and brain rest. So if academics are online and involve a screen and can be taken to paper and pencil like they were in previous years, that is really helpful for the brain. Also reduce workload in terms of if a student is studying for a test and needs to do 20 items, probably great to give them 12 to 15. Give them tasks that require and address the most important and salient parts of a curriculum, and then giving them time to rest is really helpful.
Maybe giving them more time on tests or more time for
Yes.
assignments or something is fair for a parent to ask.
Absolutely. Reducing stimuli, noise canceling headphones, putting them in a place where they won't have visual stimuli being distracting them. Really just trying to make it so that a child can focus on work in a setting that doesn't increase that stress level, because increased stress is also not what we want for the brain. We want to have that stress level as low as we can, knowing that there might be some stress related to the injury and to the recovery itself, but trying to minimize that is very important.
And when you talk about exercise, what about meditation, yoga, those kind of exercises or mindfulness? Is that something that you think I know it's hard for kids to think about
Yeah.
relaxing and meditating and not being overly active, but I'm wondering about looking at those kind of activities.
Those can be wonderful for helping the brain rest and the brain recover. Breathing is so helpful for all systems in the body, great for reducing inflammation. Getting kids bought into doing yoga and mindfulness can be a different
Yeah, I
a
was going to
different
say that might be a
task.
difficult one, but
Might be a difficult one. We have to be aware that we don't want kids who are meditating to be perseverating so much on their injury and thinking about their injury so much. What we're
Good
hoping
point.
to do is to get kids possibly into that endorphin level, zone 2 heart rate of exercise, where they can just be exercising, getting that heart rate up, breaking a sweat,
Sure.
and enjoying the movement of the body. But meditation can be something that's helpful for that.
Are there any, there's a question on here that I think is really interesting that I think is probably from one of your mom friends, Colby, and they ask about if there's any sort of like supplements or nutritional things that might aid in recovery. Any suggestions or thoughts you have around that?
I have not seen the studies and literature highlighting supplements for concussion recovery. But what I will say about recovery is that we have to look at recovery like we would look at any other part of the body. And we want to keep inflammation at a minimum to be helping that child to have really restful and sound sleep. So following a diet that helps keep that inflammation low can aid and facilitate in sleep is really important. So we want to make sure that we're not giving caffeine to the child so that they can really rest and recover, and not giving them foods that will increase inflammation in different parts of the body. Whole foods, and doing what we can to make sure that that child is just really resting and sleeping very well at night.
That makes sense. I'm wondering if you have any suggestions for parents who, I think we've kind of established that a lot of times concussions are probably unavoidable in terms of kids being kids. Things are going to happen. But do you have any suggestions for parents who want to prevent that from happening as much as they can, even though that's probably pretty limited, I'd assume?
I would say anything that requires a helmet should have a helmet. In as much as we want to limit children with exposure to activities that might be associated with a head injury or a concussion, we have to understand that we have to strike a balance, because removing a child from all activities that are really physically vigorous and are fun and are part of groups of kids and part of a collective, we want them doing that. Removing them from all of that does have a cost to the social development of children. And what I would say is, in as much as a concussion is an adverse event to the brain, we have to be aware of how important to the brain that socialization is for children. Socialization is probably one of the best tonics that we can give children, and especially adolescents, to get them spending time with other kids in real life, being outside. Oftentimes, kids being kids, that socialization piece will involve some type of play where a head injury can happen. It's also important to be really aware that children's bodies have evolved over time to respond to bumps in the head, and they will get bumps in the head. By and large, the vast majority of those are not concussions. And it's also important to be aware that if there is a mild concussion, nearly 80% of those children recover within 3 weeks. So being able to look at it in terms of the long-term health of children and supporting their growth and development across all domains is really important.
So I'm going to go to another question here that somebody has asked about resources for the parents. Somebody wanted to know, how helpful are the CDC heads-up concussion guidelines for youth sports like soccer? And is there any other resources like concussion clinics out there that families in our community might not know about?
I would say the CDC's guidelines are very helpful. The other place to look is a place that's called Impact Testing, and they are, I believe, based in Pennsylvania, and they started the concussion baseline testing and evaluation. Having that part of your child's healthcare protocol can be really helpful, but not all schools and not all clinics have it. So I would say, if that is not a possibility, communicating an interest to a child's primary care provider or pediatrician is really helpful. There are sports medicine medical doctors who specialize in pediatrics who are invaluable resources if there is a bump in the head, and they can be brought into the loop if a child is injured. Having them available can be really helpful and assuring to children that they can and they will recover from almost all of these injuries.
Yeah, I feel like we're talking a lot more about concussions than we used to, which is great. But it's always, like I said, I'm so glad you're talking about it in a whole realm of things, instead of, because we think of football. That's the first thing we think about, right? And maybe
Right.
soccer, because we hear about the concussions and all the advances they've made in football to help with concussions. Are you seeing advances in other sports or that's trying to prevent concussions, or try to, maybe it's different gear that they're wearing or rules or anything that's going on? Because we really hear it about in football, but not as much, I think, in the other sports.
Yes. One of the reasons we heard about that in football was that was one of the places in the data where we saw that concussions were happening. And the NFL in particular and Division I colleges have taken great effort to reduce the number of concussions. And what they found, and I think this is important for sports as a whole, is that changing the technique of how tackling happens has been valuable. There are collegiate programs now that have changed the types of helmets that they practice with, so that players are now tackling solely with their shoulders and not using their heads at all to protect the head from that head trauma. But looking at sports to say, where are the injuries happening? How can we assess the technique that's underlying when the injury happens? And then how can we change that technique is really important. When I did my PhD, the theoretical framework that my program had, it wasn't behaviorism or psychodynamic. It was looking at public health. So looking at really large data sets and understanding what are the contributing factors that might increase different health outcomes. And we see that if we can change a technique of certain sports, that's something that can be really helpful. The other thing that we're doing more of is understanding getting that baseline assessed before a sports season can happen, and really understanding who a child is so valuable, really, for everybody who works with that child. And not necessarily waiting for it to be a significant brain injury before we call it a concussion or pulling a kid out of a sport, but we want to be looking at ongoing small changes that might be happening and intervening as much as we can during that. So looking at what that delta is and then responding appropriately.
Yeah, that's such good information. And to go back to football, because this is something that I'm familiar with, and maybe they're doing this in other sports, but I love that at least in the NFL, they have the concussion tent now, right? So
Uh-huh.
if you get hit in the head, you have to go in there and get assessed no matter if you say you're okay, if your coach says you're okay. It's protocol. And the coach can't go in the tent, so they can't say anything to change the outcome. And I don't know if that's happening in other sports, but I hope that it is, because I think that that is something so valuable. And going back to what we said in the beginning, having that non-biased person, I guess, that can evaluate that. I like to see that. I think it's interesting.
Yes, I agree.
Yeah, and I think it's easier to monitor football. I mean, it's obviously what people think of as like the hardest hitting, very hard hitting sport. And when you look at, soccer and baseball and all these other sports, you don't really have the luxury of having all the pads and the helmet and all that stuff. There's really no way to protect yourself and to monitor that, I think, as you do with football. But one thing I think, kind of what Grace was saying, the strides that they've made is also how you attack, or like if you have, if you hit a certain way, then you're booted out and you're out of the game, right? So where do we come in and have, okay, maybe in soccer or something, right? We're looking at how a hit is done or getting too close or something. I don't know what, but we're kind of putting stronger rules on what we're allowing for during play.
Right. Yes. It would be great if we could do that with sports across the board. What we see is sometimes concussions are happening in sports like skiing that make it really hard to do things like that because they're so fast and so intense that having that type of intervention can make it really difficult. But being aware across all sports, all athletics, that contact to the head is something that we want to avoid. And when we look at how many of these sports developed and were intended to be played over time, it wasn't necessarily the contact to the head that was part of how people wanted it to evolve. It really involved athleticism in and of itself. Having the head as a point that is used in the game to gain an edge on a competitor seems like it's something becoming more passe than accepted.
Yeah, and when you bring up that point about skiing, that's certainly something I've never thought about, a concussion from something like that. But again, I think it speaks to your point of how important it is for parents to have an understanding of their kids' baseline, right? And to continuously be checking in with that. Because maybe, yeah,
Yes.
you don't even
Yes.
know that it happened.
Yes. And I would say USA skiing has been probably one of the best with the Olympics that just happened in communicating the need for ongoing assessment and monitoring of concussion and brain health with athletes who are doing those activities.
Yeah, it's crazy to think, talking about wearing helmets, right? I think about growing up skiing and nobody wore a helmet skiing. I was unheard of, You looked weird if you're wearing a helmet. Now I go
Right.
down, if I ski, I see someone going down without a helmet and I think, "Oh my gosh."
Right.
Like,
Absolutely.
why is that person not wearing a helmet, or what's going on? So we've come a long ways there.
Yes. It's become normative, fortunately.
It's become, yeah. So
Where do you hope that the world of this research and concussions go in the future? Do you have any hopes or goals?
Well, I'm very interested in understanding if people have experienced multiple concussions over the lifespan and they are midlife or beyond. I think it's really important to understand, does the brain have ways of compensating that we might not even understand now? Are there different parts of the brain that might be coming in to assist with that brain injury over time? The other thing that I think is really interesting is that as we're understanding the importance of data and high level data analysis related to public health and head injuries, is what are the things that we can do to reduce the likelihood in different sports and activities of those head injuries happening? Are there different techniques? Are there different strength and conditioning things that we can put into place? Are there different rules that we can put into place with different sports? So being open to looking and intervening in sports that we might not even be thinking about right now, I think would be so helpful. And then just understanding that the way an adolescent recovers is going to be very different than the way an adult recovers. And having that therapeutic alliance with our clients is so important, that if they tell us that they are feeling different and something just doesn't feel like it's normal anymore, being able to assist them and work with them through that recovery is really important.
Yeah. And I think, when you say it's different for adolescents than it is for an adult, and I think, you've touched on it earlier, was the big difference is that as an adult, we know our signs. We know when we don't feel right. We know we can take ourselves in. You know, youth doesn't really know that, or again, they're not going to say anything, or they don't want to be pulled out of a sport. So as a parent, again, I know we talked about this, but it's very important to kind of know those signs, or to pry and
Yes.
and find out. So because they're not going to take themselves to the doctor, or they're going to keep on going.
Yes, they are. Definitely.
I think the thing I love the most about doing my podcast is how much I learn from every single one of them, and this is no exception. I mean, the wealth of information that you have given us is so valuable.
Great.
Thank you so much. We really appreciate you coming in and talking about this topic. And like I said, I had a lot of friends that had a lot of questions. And so hopefully we got a lot of them answered. If not, we will be putting resources on our website at the Children's Home, children'shomeidaho.org, so that they can have all those resources and more questions answered.
Thank you so much for having me. It's been wonderful speaking with you.
Thank you, Leah. We really appreciate your time.
Thank you.
And I do want to let everyone know that we are going to be having you back. We have so many more topics to talk to you about, because we sat in my office, right, about a month ago and had a whole list of things we wanted to talk about. So this is one of many. So we look forward to having you back.
Likewise.
Okay.
Thanks,
Thank you.
Leah.
Thank you,
so
everyone.
much. Take good care.
Take good care. And before we leave, just want to let everyone know that you can go to themindfulmike.com for all the latest episodes. And you can also listen on your favorite podcast platform, or on youtube.com, which is so exciting for us. So with that, everyone take care and have a great day.